Hi everyone, my name is Dr. Prashant. I am the Medical Director at Medlife. I want to invite you to spend a few minutes of your time learning CPR as a part of #BecauseHeartMatters campaign. CPR stands for cardiopulmonary resuscitation, which means reviving the function of heart and lungs in a patient who had cardiac arrest. This is a life-saving maneuver that everybody should know. It can mean the difference between life and death. Remember, you don't have to be a medical personnel to do a CPR. Anybody can learn this technique and save a life. Before we discuss CPR, I would like to clear the difference between heart attack and cardiac arrest. Usually, patients with heart attack will present with severe chest pain. There may be associated intense sweating, breathlessness, or nausea. This happens due to blockage of one or more of the heart arteries. The patient will be conscious and will be able to communicate his problems to you. You should immediately call the ambulance. We do not do CPR in such cases. Patients with cardiac arrest, on the other hand, are unconscious and unresponsive. The underlying problem is that heart has stopped beating normally and is just vibrating or fluttering. This loss of pumping action stops the blood flow in important organs like lungs, brain, and the heart itself. Immediate CPR in these particular cases is necessary for survival. A question that you might often ask is, why should I learn to do CPR? Let me tell you some interesting statistics. About 90% of cardiac arrests occur at home, and less than 8% of these patients survive. Giving an immediate CPR can double or triple the chances of survival in these patients. This is because irreversible brain damage starts in 3 to 5 minutes after cardiac arrest. Therefore, the faster a CPR is started after cardiac arrest, the better are the chances of recovery. We would now talk about hands-only CPR, which should be used if the victim has suffered from cardiac arrest in or out of hospital setting. If someone falls unconscious in front of you, do not waste time and immediately follow the following steps. It is important to recognize that the victim had a cardiac arrest. The person might have collapsed in front of you or might have collapsed before you arrive at the scene. First, you ensure that the scene is safe to approach the victim. You then assess for victim's responsiveness. You check for signs of life, like breathing. You would want to assess whether the patient groans or moans, whether he is opening his eyes. What you need to do is you grab the shoulders and shake or tap the shoulders vigorously and ask in a loud voice, "Are you okay?" In case the patient is unresponsive, seek help. Ask any bystander to call an ambulance and get an AED. For the demo, we have a mannequin here. Let's retrace our steps and understand what has been taught till now. If a patient goes unconscious, the first thing that you need to do is check whether the scene is safe to approach the victim. If the scene is safe, you immediately come to the victim and assess responsiveness. How you need to do it is, you tap hard on his shoulders and ask, "Are you okay?" "Mr. Sharma, are you okay?" If there are any signs of life, like if he's breathing, if he's opening his eyes, if he's groaning and moaning, that means he's going to be fine. If he's not, if there are no signs of life, then the second thing that you need to do is immediately ask a bystander to call an ambulance, dial the number 108, and if possible, get an AED. After you've done that, immediately start the CPR. Now we come to the most important part of CPR, that is giving the chest compressions. If done right, it can really save a life. The first thing that you need to understand is that the victim should be on a flat, hard surface. If the victim is on a bed, please get him down to the floor. Okay? The second thing that you need to understand is bare his chest so that you can actually see where to put the hands. Then you take the right hand, check the heel of the palm, place it in the center of the chest. Now a question arises, how do you find the center of the chest? There are two ways to do it. The first is you simply take the center in between the nipples over the breastbone and place your palm there. The second thing also you can do is you slide your hand up, find the fold of the axilla and then come to the center. Just come on top of the breastbone, place the knee of the palm, interlock your other hand and then keeping your elbow straight and shoulder exactly over the victim, start the chest compression. It is important that you keep your elbows straight and shoulders directly over the victim because this will help you use your own weight to give proper compressions. There is one golden rule. You have to push hard and push fast. When we talk about push hard, you need to do the compressions pushing the chest at least 2 inches or in common parlance 1/3 of the breadth of the chest. You have to push fast. The rate of compressions should be 100 to 120 per minute. Let me show you how. So after you have checked for responsiveness, you check the 2 nipples, create an imaginary line, put your palm in the center, interlock the second hand, okay? Come over the victim, bend forward, keeping your elbows straight and shoulders directly over the victim. You start the compressions and it's always a good idea to count it aloud, okay? So it'll be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. You have to compress the chest at this rate and you have to continue doing 100 compressions per minute till the victim shows sign of consciousness or help arrives.